and then work back upwards on that area. The thyroid area, so that reflex is going to be found in the area covering the ball of the big toe. So start with the left hand on the spine side of the foot and follow that L-shaped pattern tight in beneath the ball of the big toe and then up the side of the ball of the big toe. And you will have overlapped the lower parathyroid reflex just as you head upwards towards the web between first and second toe, and then the upper parathyroid reflex just below the web between first and second toe. Then fill in that area using that same L-shaped pattern. So starting on the outer border, working across and then upwards until you've covered the entire area. Then the lung reflex. So that's going to be zones 2, 3, 4 and 5 over the rest of the ball of the foot, but remembering on the left foot you also have the heart reflex, with the indirect reflex being found mainly in zones 2 and 3, just above diaphragm level. So for the lung area, start just beneath the second toe using the left hand and work across all the zones, then change hands, come back again, and then just keep changing hands, going backwards and forwards across the area. And in the lower part of the area, just work zones 4 and 5, leaving a space for the heart reflex, which you'll work on having completed the lung area. So the heart reflex in zone 2 and 3, just above diaphragm level. So be careful as you work on that area. Probably the reflex that you have to take the most care on out of all the ones in the foot. Then the solar plexus reflex. So that you're going to find at diaphragm level. So diaphragm level, where you get the arch to the foot. Zone 2 and 3, just below diaphragm level. So solar plexus reflex. A slight dip in that bit of the foot. Then the areas between diaphragm and waist level. On the left foot, you have in zones 4 and 5 the spleen reflex. So just work from the outer border of the foot, just working straight across from zone 5 to zone 4. Then the rest of the area between diaphragm and waist level in zones 1, 2 and 3 will relate to the stomach and to the pancreas. Now the stomach reflex will be in all of that area, the pancreas reflex just in the lower half of that area. So again, just work across the zones. So start in zone 1, just beneath just to zone 3, then change hands and come back again. And just keep going backwards and forwards until you have covered the entire area. Then on to small intestine. So that is the area found below waist level and above the pad of the heel, zones 1, 2, 3 and 4. So start in zone 1 using the left hand and then work across just below waist level, and then just go backwards and forwards. And you need to go finish off in an area just above the pad of the heel. Then the remaining parts of the large intestine. So back up to waist level in zone 1 and work straight across the foot for the reflex to the transverse colon, which is going to go across into zone 4, zone 5. Then change hands and come down the reflex for the descending colon, and then above the pad of the heel turn to come across all the zones for the reflex for the sigmoid colon. And that will end with the reflex to the rectum on the side of the foot. Then the bladder area. So that is that puffy area that you sometimes find on the inner border of the foot, but also the bladder reflex will be found slightly underneath the foot. So starting on the bladder area on the side of the foot, work upwards and outwards to waist level, zone 2, zone 3 for the kidney reflex. And just on top of the kidney reflex, in zone 2 but veering towards zone 1, will be the adrenal reflex. So that will just be a little bit higher than waist level. Then on to the sciatic loop. So that you find a third of the way down the pad of the heel, across that often rather tough bit of the foot. So it doesn't matter whether you work across from right to left or from left to right, as long as you're moving with the thumb pointing in a forward direction. And then you can fill in that whole area as well to ensure that the whole foot has been massaged. Again, it doesn't really matter which hand you use as long as you have the forward movement. The continuation of the sciatic loop on the sides of the foot, so fingers to the side, just work back across the side of the foot and then up the back of the leg, just on either side of the Achilles tendon for about 3 or 4 inches. Then put the hand underneath the back of the leg, don't raise the leg too high or your tendon. And then just the pinching action coming down the back of the leg, just on either side of that tendon. Then onto the outside of the foot. The sacroiliac joint reflex on the outer border of the foot, that little dip in front of the outer ankle bone, about in line with the 4th toe. And then the area below the outer ankle bone relating to the pelvic muscles. So massage a couple of times just underneath the ankle bone. Then the knee and hip reflexes. So the 2 half moon shapes between the bony projection on the side of the foot and the very back of the heel. So just imagine the area which they're occupying on the side of the foot. Just work up from the side of the foot, filling in those areas drawn. Then the reproductive areas. On the outer border of the foot, halfway between the tip of the ankle bone and the very back of the heel, is the reflex to the ovary in the female or the testis in the male. Finger pressure is sufficient on these reflexes. The reflex to the uterus in the female or prostate gland in the male is found in a similar area on the inside of the foot. Joining these 2 points over the top of the foot, just in front of the ankle bones, is the reflex to the fallopian tube in the female and the vas deferens in the male. Use the thumb to go right over the top, round to the uterus area. Then the lymph reflexes on the top of the foot. So you're going to need to work down each channel in turn from the roots of the toes to above the ankle bones. So finger pressure or using the thumb. Really, I think probably using the fingers is easier. So just work down each section in turn. So you're starting with the upper lymph nodes, then you work down through the thoracic region and overlapping the breast reflex, then down through the abdominal area, and then the pelvic and groin lymph nodes you'll find around the ankle bones. So having covered the whole of the top of the foot to above the ankle bones, then just circle around the ankle bones, finger pressure, or just circling round for the pelvic and groin nodes. And then the pinching action between big toe and second toe, equivalent to the lymph drainage point. And you can do just once or twice, and do each toe in turn if you want to. Then you have done all the points on that foot, so it's the exercises to the foot. Rotation of the toes. So support the big toe joint with the left hand around the left big toe joint, and then just rotate the big toe round in either direction. And as you rotate that joint round, it's a bit like rotating the neck round. Then each toe in turn, so you can still keep that same grip on the foot, possibly swapping hands for the fourth and fifth toes. Then the ringing action, so the fingers on the top of the foot, thumb underneath, right hand around the little toe, other hand placed similarly but beneath, and just ring the foot apart, so spreading the bones out in the feet. Then the kneading action, so using the flat bit of the fist up at diaphragm level, place the other hand flat on top of the foot, press the hands against each other, but at the same time rotate the hands round. And then the ankle rotation. So just put one hand slightly underneath the heel, just to raise the foot slightly, and then just rotate the ankle joint round. Don't force that movement. If there's not much movement there, then just accept just a small amount of movement. So that completes the reflexology treatment. You will have massaged all the reflex areas in the feet, and you will have therefore treated all the different parts of the body. Then you would go back over certain reflexes and give them extra attention, knowing which reflexes were important for the patient that you were treating. The very final part of the treatment is the solar plexus breathing exercise. So for that you place the thumb on the solar plexus reflex of each foot. You will apply pressure to that reflex as the patient breathes in, and at the same time ease the feet upwards slightly. Then as they breathe out, you will ease the feet down and ease the pressure off the solar plexus. So if you like to take a deep breath in, ease the feet up and then out. Once more. Then ease the pressure off as you ease the feet down towards you. And that is the full treatment. The actual treatment session will have taken about 3/4 of an hour, so that when booking in patients you would allow an hour per session, which will mean the patient doesn't have to rush to leave directly they've completed the treatment. You might discuss briefly with the patient the possible effects they may have as a result of the treatment, and by the end of the treatment the patient should certainly be in a very relaxed state.